The droopiness on the side of the face is due to a problem in nerve number 7, like you said, a Bell's palsy. So cranial nerve 7 is called the facial nerve. Its job is to innervate the muscles of facial expression. So, when she's excited for her ear to perk up, like we said, we bring our hand to her eye for her eye to blink. And when we have a problem with the balance nerve, things we might see are incoordination, the head being tilted to one side, and abnormal eye movements, what we call nystagmus. Sometimes we see abnormal eye position, what we call strabismus. So we're seeing lots of those things with her. Cranial nerve 7 and cranial nerve 8 are right next door to each other, so we often see one affected at the same time as the other. So what are the things that can affect cranial nerve 7 and cranial nerve 8 at the same time? We worry about things like ear infections. That would be the best thing. Sometimes we can get what's called idiopathic, which means we don't find an ear infection or a tumor or a stroke, or we don't find an underlying cause. That would be a relatively good cause as well. But we also have to worry about things like meningitis and encephalitis, just adult Chihuahuas, we see that in them. Tumors are possible. Dogs do get strokes as well. So those are the things that we worry about. On the one hand, we're better today than we were on Saturday. On the other hand, we've got some worrisome things on the list. So my recommendation would be that we do some tests to try and figure out what the underlying cause is. Even though we're a little bit better today, just because things like meningitis and tumors can get better but then get worse, my recommendation would be that we do some tests. The tests that I would recommend, and we've already done some blood work, mainly the only way that I can see the brain and see the inner ear is by doing an MRI. So that's my recommendation.
Doctor Who's owners decided to proceed with an MRI to determine the cause of droopiness on the right side of the face.
So what we're looking at here on the left side is Dr. Who from the side. So we're looking at her in profile. This is the nose, this is the forehead, this is the top of the head, this is the neck. This is the brain here. This is the front part of the brain. This is the back part of the brain. If we think of her as a loaf of bread and we make slices, that's what this picture is over here. So this is a slice made right where this green line is.
Okay.
So this is our right side, left side, top of the head. So it's like her nose is going into the screen and her rear end's coming out towards us.
Right.
So the easy way of looking at the brain is, does the right side look just like the left side? And as I scroll back, we'll get a new picture and the line's going to move from the front of her brain to the back. The brain's very, very normal. And then where we start looking is down here, is where cranial nerve 7 and cranial nerve 8 live.
Right.
This is the middle ear canal, this is the external ear canal, and they actually both look very, very good. We look in multiple ways. This is what's called a gradient echo sequence, and it looks for evidence of hemorrhage or blood. We look before and after contrast. So this one's before contrast and this is after. And basically I don't see any evidence of tumor or stroke or inflammation or ear infection.
Wow.
So the next thing we did was a spinal tap. Spinal tap looks at the number of cells. So we look at the fluid, we look for the number of cells, the type of cells, the protein level. I look at the number of cells in-house and it was normal. Normal's less than 5. She had 3 nucleated cells per what's called microliter. So by my eyes, it's normal. We're still sending it off to the lab for their opinion, but I would be shocked if they came back and said anything else. So overall, this is fantastic news. This is what we call idiopathic facial nerve paralysis. That's something that usually gets better on its own. Sometimes it doesn't get better, but it shouldn't worsen. So this should not turn into things like seizures or behavior changes or anything like that. This shouldn't shorten her lifespan.
Overall, Doctor Who's prognosis is excellent. However, the prognosis for recovery of blinking and moving the right side of the face is more guarded. Dr. Wong prescribed artificial tears to keep the right eye lubricated by administering eye drops several times daily. Full recovery may take several weeks to months. Beatrice is a 7-year-old dachshund who experienced an episode of back pain about a month ago and was treated with medication. But after catching a large iguana in her backyard a couple days ago, the back pain and discomfort returned.
On the one hand, because her symptoms are relatively mild, meaning pain only, we have the option of continuing with one more course of rest and medications. The advantage of that is it might help just like it did last time, and as long as we don't get to chase iguanas anymore, which I know is easier said than done, hopefully it doesn't happen again. The second way of looking at it is, well, gosh, it's recurrent now at this point. It happened at the end of May, and just a month later, we're painful again. So when the symptoms are recurrent, when they keep coming back, it does make sense to consider tests. So on the one hand, mildly affected, saying, hey, let's not do tests. On the other hand, it's, strike two, so to speak.
After weighing the pros and cons of proceeding with advanced imaging or just continuing with medical management, Beatrice's owner decided to move forward with an MRI to determine the cause of recurrent back pain.
So here we're looking at Beatrice's MRI. We're looking at her lower back here. This is her back. Her belly's down here. Her tail would be in this direction and her head would be in this direction. These are the bones of the back. Dogs have 7 lumbar vertebrae. So this is L7, L6, L5, L4. This is the spinal cord, and this is the disc in between each bone or each vertebra. If we think of her as a loaf of bread and we make slices, that's what this picture is over here. So this picture is a slice made right where this green line is. If we slide forward just a little bit, this picture is made right where this green line is. And what we can see is the spinal cord here. This is the right side, the left side, the back, the belly. This is the disc. This is the spinal cord. And as I scroll through, we'll see a new picture here and a new line there. Even as we start to scroll back, we start to see there's something here in the left side, just under or ventral to the spinal cord, that's compressing the spinal cord, causing attenuation of the fluid signal or the bright line around it. As we get through, then we're back to normal. So that is a intervertebral disc herniation at L4-5 on the left.
Due to the fact that Beatrice's examination was normal and the MRI showed a mild slip disc at the L4, L5 range on the left, Dr. Wong recommended a course of strict rest and medications.
So one of the patients we saw today was Spike, a 2-year-old French bulldog. Spike came to us with a history of back pain. About 2 weeks ago, he had an episode of back pain and rear limb weakness, but it got better with medications that were prescribed by his veterinarian. His veterinarian also recommended strict rest, but because he got better so quickly, the owners hadn't rested him. Over the weekend, he had another episode of pain and rear limb weakness, and they started the medications again, and today he's back to normal. So on examination, he was 100% normal. No evidence of pain, no evidence of incoordination. So we were in the dilemma of, on the one hand, he's back to normal, so is it reasonable to continue with rest and medications? Yes. Whereas on the other hand, he has recurrent back pain. It's happened twice in a relatively short period, so would it have been very appropriate to do an MRI today? Yes. So we offered both options to the owner, and based on the pros and cons, they elected to try rest and medications because they had not strictly rested him before. But this led to the question from the owner of what's the likelihood of this happening again to her pet? And whenever we're talking about a dog that we suspect a slipped disc, if it's a slipped disc and we manage it medically, there's about a 50% chance of there being another problem at some point in that dog's life. Whether it's as mild as it was this time for Spike, or whether it's more severe, meaning unable to walk or unable to move or feel the rear limbs. So there's about a 50% chance of that happening again at some point. Whereas with surgery and a preventative procedure called fenestration, there's only about a 10% chance of recurrence. So that's one of the pros of considering surgery, but because Spike had not been strictly rested and because he was back to normal today, it was very reasonable to try a course of strict rest and medications.
Who are you looking at, Dr. Wong?
Dr. Who?
You're Dr. Wong, right?
Right, I'm Wong.
But who are you examining?
Dr. Who?
No, who's the dog?
Who's the dog?
Right, but what's wrong?
I'm Wong.